The ApoA1 and ApoB ratio, a concise scientific overview. The ApoA1 and ApoB ratio reflects the balance between anti-atherogenic ApoA1, the main structural protein of high-density lipoprotein HDL, and pro-atherogenic ApoB, the primary apolipoprotein in low-density lipoprotein LDL particles. ApoA1 promotes reverse cholesterol transport, removing excess cholesterol from peripheral tissues to the liver, while ApoB facilitates cholesterol deposition into arterial walls. This ratio thus provides an integrated measure of cardiovascular risk, representing the equilibrium between protective and harmful lipid pathways. Substantial clinical evidence supports the ApoA1 and ApoB ratio as a robust predictor of cardiovascular risk. Long-term cardiovascular risk. The 20-year Attica study found the ratio significantly predicted increased atherosclerotic cardiovascular disease (ASCVD) incidence, particularly in males under 40 years of age. Correlation with risk scores. Research shows a strong positive correlation R equals 0 for 6.3 between the ApoB and ApoA1 ratio and Framingham 10-year coronary heart disease risk scores, with the ratio progressively increasing across low risk, intermediate risk, and high-risk groups. Prognostic value in specific conditions. A study on intracerebral hemorrhage patients determined that a ratio 0.85 was an optimal cutoff for predicting poor prognosis, with a high ratio group having a 3.9 times higher mortality risk. Furthermore, in polycystic ovary syndrome POCOS patients with metabolic syndrome, the ratio was significantly elevated and correlated with adverse metabolic parameters like BMI, waist circumference, and insulin resistance. Genetic insights. A genome-wide association study (GWAS) meta-analysis of Korean cohorts identified novel genetic variants associated with ApoA1 levels, reinforcing the genetic underpinnings of lipid metabolism and its link to CVD. This study also noted a positive correlation between ApoA1 and vitamin D levels, suggesting a potential interplay. The ApoA1 and ApoB ratio is a valuable composite marker for evaluating lipid metabolism balance and assessing long-term cardiovascular risk. Its strength lies in simultaneously quantifying both protective and harmful lipid components. Interpretation should consider age and sex differences, as evidence suggests it is particularly predictive in younger males. For optimal cardiovascular risk management, this ratio should be interpreted alongside traditional risk factors. For example, blood pressure, smoking status, and other lipid parameters within a comprehensive clinical assessment framework.